this is the ultrasound study of a 30 years old male with the history of backache for the last 3 years, backache, and none other symptoms is he presenting or has presented with. As usual, I don't have any lab profile, I don't have any investigative procedures like X-ray, etc. And ultrasound, what I am seeing is, so here with me. Here I am longitudinal in the epigastric region with probe slightly towards the left side, and what I am seeing is a nutcracker sign. Nutcracker sign is when you see the superior mesenteric artery being elevated by lymph nodes between the aorta and the superior mesenteric artery, as you are seeing in this particular case. Now, to show you, get you a better view, you see there are two lymph nodes. This is a lymph node and this is a lymph node. This is the aorta, and this vessel is the superior mesenteric artery that is arising from the aorta. Now keep your concentration on this region, and I am going to magnify a bit. Now this is the actually full size of the lymph node that measures 21 by 13 millimeter, and the other one is this one. This is the lymph node, and this is the another lymph node. So there are in fact three. However, two are the larger ones that are seen in the para-aortic plan. This is the aorta, proximal aorta, in longitudinal section, and if you see this vessel, this is the superior mesenteric artery arising from the aorta, and these are the nodes. So this is what we call as para-aortic plan lymph nodes. These are all nodes. This is a lymph node, this is a lymph node, this is a node. So this is a lymph node arising, and now they are in the para-aortic plan, and they are elevating the superior mesenteric artery. Thus, and the sign produced by this is called the nutcracker sign. Here we are again. Now you can see there are abundant. These are all lymph nodes in the paravertebral or para-aortic region. These are all lymph nodes. They are not vessels, because let's say if you say, well, if someone asks you, I think this is a vessel, I think this is a vessel, how do you say that this is a lymph node or some mass? So the trick is that you give a sweep through the probe, keeping the area in the center of the screen, rotate the probe 90 degree or even more. I have rotated the probe almost 180 degrees, and I did not see any change in the shape of this solid area. Now you keep your, suppose we talk about this area, I say this is a lymph node, then when I rotate the probe, it does not change its shape, it retains its shape, which is confirmatory, number one. Secondly, you don't see any posterior wall enhancement, and its lining is so clear. Same will happen with this one, and same you can reproduce with any area that you consider to be a lymph node or a mass. You have to manipulate the probe to get this, to be sure about it. So here you see the superior mesenteric artery is elevated, and this is the lymph nodes. There are lymph nodes in between the aorta and the superior mesenteric artery, thus giving, elevating the superior mesenteric artery and giving it a nutcracker sign appearance. This is a case of adenopathy, para-aortic plan adenopathy, as well as paravertebral plan adenopathy, as we do see a bunch of nodes here. These are all nodes, lymph nodes. And this is the aorta. The IVC. This is the aorta. This vessel. This is the aorta. Here are the nodes. When I go transverse, I see multiple lymph nodes, both sides of the aorta. Similarly, this is the spleen. Spleen is not enlarged, and this is the splenic vein. This is the splenic vein entering the hilum of the spleen. And what is this? This is the spleen. What is this? What is this region? This area? Now this is in fact another lymph node, and this lymph node is at the splenic hilar region. So this is a case of para-aortic plan, paravertebral plan, as well as an adenopathy at the splenic hilar region. With no other positive finding. You see, this is the parapancreatic plan as well. You see, this is the pancreas, this is the duct, this tiny vessel, the splenic vein. This is the lymph node. This is the superior mesenteric artery, because it has echogenic borders. This is the aorta. This is the left renal vein entering into the iris. This is the lymph node in the parapancreatic region. This is the superior mesenteric vein. This is the liver. This is the ligamentum teres in transverse section, giving shadow. So in this region, in this plan, transversely, we can see a lymph node in para-aortic plan as well. So there is a lymph node in this location as well. So this is a case study regarding adenopathy. Paravertebral with the differentials of, in our culture, in our area, Cox infection or granulomatous disorder will be considered to be the differential number 1. However, second will be blood dysplasia. So has to be correlated with the lab, relevant lab profile. Now you see this is a magnified view of the lymph nodes in the paravertebral location. Thank you very much.